Friends, welcome to my workplace at Ranaghat, West Bengal, India. This is a cataract with grade 3 nuclear sclerosis. In this case, I have done direct chop and aspiration of the cortex by the Phaco handpiece itself. Let us observe the surgery. By this time, the main incision has been made. Visco has been injected into the anterior chamber and it has been applied over the corneal epithelium. This is a side port on the right side of the main incision, and this is another side port on the left side of the main incision. And now, capsulorhexis. The anticapsule is torn and a capsular tag is raised. This capsular tag is guided anti-clockwise in such a way that I get an adequate sized rhexis of about 5.5 millimeter. It is done. And now hydrodissection. BSS and a 27 gauge cannula is being used, attached to a 2cc syringe for hydrodissection, and the nucleus has rotated nicely. Visco is injected again into the anterior chamber. The patient is under topical anesthesia and the patient is moving his eye quite a lot. And this is introduction of the Phaco needle with its bevel down. Some superficial cortical lens matter is removed, then the handpiece is turned to make the bevel up. And now watch direct chop. Bury the tip into the substance of the nucleus, hold the nucleus firmly and chop it. It is so easy. Once you learn this direct chop, you will not go for stop and chop or divide and conquer technique. In most of the cases, you will do this technique except for very soft cataracts where you cannot hold the nuclear mass with vacuum. This is the last nuclear piece. Ultrasonic energy used is 60%, flow rate is 45 ml per minute, and vacuum is 450 millimeter of mercury. Nucleus and epinucleus is managed. Now cortex. I am using the handpiece itself to clean the cortex. At this time, the vacuum is 200, flow rate is 20, and see how beautifully it has come. And now hydroimplantation of a single piece monofocal intraocular lens. This is a hydrophobic lens, and the lens goes into the capsular bag. The irrigating probe dials the lens, and the irrigating probe expels whatever visco molecules are there in the anterior chamber. This is a bit of moxie, and now the side ports are closed by hydrating corneal stroma with BSS. And now a final lavage of the anterior chamber with 23 gauge Simcoe cannula. A thorough lavage, and then the antechamber is formed nicely in such a way that the intraocular pressure is on the higher side of the normal. And then integrity of the wounds are checked, few drops of moxie is applied over the cornea, and the case is concluded. Thank you very much for your attention. Hope this video will help you in developing your surgical skills. Be a great surgeon and serve your patients with love, respect, compassion, and great surgical competence.